how important was vitamin B12, and it is required for myelinization. Myelin is a coat of or sheath of the nerve fibers. So those who do not consume milk and milk products, they are definitely prone to get this vitamin B12 deficiency. It is so severe, I tell you. So you develop such a drastic anemia and then peripheral neuropathy, which again leads to degeneration of the spinal cord also. I've seen, I work with a lot of teenagers and schools where I find that most of the children have stopped consuming curds even. How many of you do not eat curds? Only one hand up. So at least 10% I see children are hating to eat curds or drink buttermilk. Now please consume milk and milk products. That's the only source of vitamin B12 for us, and which is required for DNA synthesis. The major effect of that deficiency is on the hematopoietic system, then definitely on the other systems. So that is only source for us, and body has about 2 to 3 milligram stores. So today, if you stop consuming milk and milk products totally, so it requires about 1 or 2 years for us to develop this deficiency. So have adequate source of B12, consume milk and milk products. I'm happy even if you take, or consume cheese or whatever, if not, curds. So some of the milk products are very, very essential for us as vegetarians. Watch on the time. So please remind me at the end of 30 minutes. We may have discussion after my session. So let it be an interactive session rather than a monotonous one-page. So my interest is to educate public, not just the medical students. So to create an awareness on health and health-related aspects, I keep writing, and the medium I have chosen to write is the local language, that is Kannada, because I want to reach to people. So Professor Madhusudan wanted me to tell about this writing. I've just published a book, Pratama Chikitse. It's mainly for our school teachers and children. And recently I wrote a book for SSLC students again in Kannada, because on Youth Day, that was Vivekananda Jayanti in January, we had a program for SSLC students in Harihar. So I've just written a book on how to study, because a part of my duty in the college is in Department of Medical Education. So where we do deal with teaching learning methodologies. Then apart from that, I go to different colleges and I take part in a lot of activities by the education department, so that is related to health, especially teenage health. So I just wrote a very small booklet for our teenagers as Kishori Arogya Samrakshana Day, and I translated a Telugu book too on, again, this is how to study. And a lot of my books in Kannada are under publication. And I wrote a book for our dental students on general pathology. So I do keep writing. So I said I need to get incorporated into your food and technology department, and along with Madhusudan sir, I said, let us write about all these, food and its values. First I said, let us take up this flaxseed. I was asking him, I read so much about flaxseed, I didn't know it was Agastya Bija. So he showed me that Agastya Bija too. I said, yes, let us start with that and educate our people, because in davangere people are used to eating Agastya Bija. They make chutney pudi out of that. So let us promote that. Same time, we are promoting, a good health. Akkamahadevi. So sir is promoting Akkamahadevi condiment stores also there. It is available. Yes. So that's about my passion for writing too. So the topic given to me was health and hygiene. So the first question I have for all of you, are you all healthy? Yes? Confident? Then I can't hear you. If you're confident, that authenticated reply should come from you. You should say yes. Yes, you're all healthy. Why do you say you're healthy? Why do you say you're healthy? You have certified yourself as healthy. I'm very happy. That is what we need to look at. We want everybody, each and every individual to be healthy. But how do you say? Substantiate your say. Is it just absence of disease? We say health is not just absence of disease. It is. And then we define health. Health is a state of physical, mental, social well-being. But WHO even accepts one more thing that is to be added. It's a spiritual health too. So when we talk of spirituality, at this level or even school going level, everybody says, this is like, hearing or listening to a Swamiji. Definitely spirituality does not just go by religion. I tell you, I quote my professor, Dr. B.M. Hegde, who is the ex-Vice Chancellor of Mahe. He says very nicely, he defines spirituality as sharing and caring. So what good you are doing? So what is that good that gives you a satisfaction? That is the spirituality. So if all these things are well balanced, good state, then we say we are healthy. So we are all born. Don't you think it's such a great exclamation? Before we were born, we didn't know where, how we would be born. But all of us now have found a place. So we have entered into this world, and all of us know that we are not going to be here throughout. So we have to exit from this world. Again, that's an exclamation. Do we all know when and how and where we are going to die? None of us know that. But all of us know we have exclamation, and in between these two, that is a journey from home to tomb. Next. So we have this question mark. So how we are going to live or lead our life is a question mark. And what all of us definitely like is we need to be healthy. You all agree? Yes. We need to be healthy. Next, you need to be happy too. Healthy, happy. Then I say you need to be of helping nature too. Not just healthy, happy, keep to yourself. Be healthy, happy, and then helping too. And this to keep you healthy, you know what is required. To keep you happy, you really need all this. But when we look at our women in India, at least we have, I think 8 months or 6 months back, we were here in your university for a blood donation camp. You were here? Yes. So many of the girls came forward to donate blood. But how many were qualified to donate blood? Probably out of 50 girls who came forward to donate blood, we said only 10 of you qualified to donate. So 40 were disappointed. They are very happy, enthusiastic. They wanted to save a life, but they didn't qualify. Do we say they're healthy? So you are the future mothers. The future generation of India depends on you. That's what Professor Manjunath said. He was mentioning about folic acid. He said, during the reproductive age group, during pregnancy, doctors are prescribing folic acid. That's again a very, very essential vitamin. So which is required for hematopoiesis, for production of blood. An adequate amount of folic acid if we have in our blood, it's going to prevent neural tube defects in children. So first 3 months when the embryo is in the uterus, so there is the development of this neural, so there is deficiency, it leads to neural tube defects. So such an important vitamin is folic acid. So how many of you have adequate levels of folic acid? So again, we go back, I say 1 glass of milk. So this is what I tell all the mothers. Milk is not just for the mother to give it to the children. Mother also should have a glass of milk with her, sit with the child and drink. Not have a cup of coffee and then make the child drink coffee, drink milk. So mother having, coffee or tea in her hand, offering milk to the child is very bad. So mother also needs milk. Folic acid is also one thing which is required for our hematopoiesis. So I'm talking about iron here, but 2 of the very important vitamins which he has pointed out, vitamin B12 and folic acid are equally essential for the hematopoiesis to keep your hemoglobin at that particular level. We say if any woman in our country has a hemoglobin concentration of 10 grams, we feel so happy. She has 11 grams of hemoglobin, so we are extremely happy. 12 and 13, we are very, very happy. 12 grams, you qualify to come and donate blood. So that's what we need to see that our younger generation, starting from teenage, not teenage, children to the adult life, even up to the menopause, all our women have adequate levels of hemoglobin. So one of the very important metal that is required for hemoglobin synthesis is iron. Since anemia is, can we just go back to the previous one? Anemia appears to be the rule rather than exception. So I'll tell you how you need to look at yourself. So there's self-evaluation here, you will know whether you are suffering from iron deficiency anemia. So this decreases the individual's productivity, then affects definitely the nation's economy. Next. So most important, why I have taken this topic here is, this is largely preventable. I was very happy to look at all the vegetables which are there, welcoming us into this, your academic hall. But I said, all these vitamins, all these vitamin-rich vegetables should daily welcome us in the kitchen also. So you need to have them. So you need to consume them daily. So easily treatable and then largely preventable. That is what makes a difference. So just the objective of this session is, let us prevent and treat anemia in one woman. So we then give a healthy mother to that family. This healthy mother will definitely play a pivotal role in raising a healthy, happy family. All of you agree that mother plays a vital role in happiness or in the health of the entire family. Next. See, anemia is the world's most widespread health problem. More than 4 billion people worldwide have anemia, and most of them are in the developing countries. But only happy thing, just look at this, we are third, at least not first in saying that anemia is first. So we have 2 more countries ahead of us, so we are in rank 3. So let us go down. So here, our first does not count anything here, but there are a lot of people in our country who suffer from anemia. Next. So when we talk of anemia, there are so many causes for anemia. So again, number 1 ranking here is for iron deficiency. Iron deficiency causing it. See, we use so much of iron. Where do we use? To build our buildings, to protect our buildings. So much of iron we use. We use so much of money on that. But why not that enough iron is being taken up, consumed by us for building our own body? So we neglect that. So this negligence is because of 2 important factors. One is the extreme end. Our country is still a developing country. We say about 1/3 of people in India cannot have one meal per day. The other extreme is, we have people who have adequate money, so they can eat anything, but what are they eating? So as again Professor Manjunath said, so food fatism. You don't eat what is required, you eat what is tasty. So that is building up and getting stored in the body as fat. So we see obesity increasing even at the school level. So I tell all the mothers, if your child is obese, don't be happy. Don't say a chubby child is a healthy child. So chubby child is always a child who welcomes all the diseases. Don't be happy if your child is chubby. Obesity is increasing, and you can see school children, lot of school children, who are putting on a lot of weight. Next. So the last 2 decades, the importance of iron deficiency anemia as a public health problem has been increasingly recognized by the health workers and policy makers. So even now we know a lot of iron tablets are distributed by our Anganwadi people to all those people who are deficient. Next. So in India, say 52% women in the reproductive age group are iron deficient. So definitely if we estimate the hemoglobin of all of you who are here, I'm sure I get 40% who are deficient. You all agree? Agree? Yes. So then you cannot say you are healthy. See, there is iron deficiency. So 74% children are deficient. Then middle income groups, about 20 to 30% suffer from iron deficiency. Then it is not just confined to our rural women. So we are all urban women, right? So it's about 60% in urban women, and rural women it is about 70%. And in endemic areas where malaria and helminthiasis is endemic, we see about 90% population, 90% of population suffering from iron deficiency. Why battling iron deficiency is important? Because iron, as I said, it's not just important in hemopoiesis, the production of RBCs. So it's got a lot of other functions too. So it's an important ingredient of lot of enzymes also, and this significantly impairs the mental and psychomotor development of infants and children. So leading to development of delay and behavioral disturbances. It can increase the risk of preterm delivery. This is what we are doing. We are seeing, many women who are delivering the babies at the month of 8th month, 7th month deliveries, all a preterm, where all the neonates are being kept in the neonatology unit, neonatal intensive care units. And delivering a low birth weight baby is again very common in iron deficient. So we see in India the average birth weight of a neonate is 2.6 kgs, but most of the neonates who are born are hardly 2 kgs. You should be very happy if you see a 2 kg neonate being born. Otherwise you see 1.5 kgs, 1 kg is even 600 grams, So where all these babies need to be nourished in the intensive care unit. Next. So this impairs the cognitive development in children from infancy through to adolescence. So it's an irreversible damage. If you see children with iron deficiency, the damage which encounters is a permanent one. So damages the immune mechanisms, and this is associated with increased morbidity rates also. When we talk of immune mechanisms or immune deficiency, which disease comes into your mind? Immunodeficiency, AIDS. So again I quote Dr. B.M. Hegde. He says it's not AIDS, acquired immunodeficiency, that's most common in our country. He says it is NAIDS, N-A-I-D-S. So what does N stand for here? So nutritional associated immunodeficiency. Children who are malnourished, so they have immunodeficiency. What does immunodeficiency lead to? Lot of infections. So that in turn leads to mortality, increased mortality and morbidity. He says rather than acquired immunodeficiency which is caused by HIV, he says you can see lots and lots of children with malnutrition who suffer from immunodeficiency and secondary infections. Next. So all these again, suboptimal utilization of energy sources by muscle cells, impaired work performance, lots and lots of problems. One of the important problem is hair loss. So you go to any girl, a teenage, so ask her for problems. So 50% of the girls will write hair loss. So I tell you, hair loss is again associated with iron deficiency. Vitamins, and especially one mineral, that is iron, which is the leading cause for hair loss too. Okay, I just want to go for clinical features mainly. Iron plays a key role in brain function. Several of the brain, in brain we see a lot of areas which are rich in iron. Iron deficiency affects or alters both neurotransmitters and behavior and delays. It's something like a repetition of the previous slide. Next. This is again, acid iron deficiency leads to impaired immune mechanism with infections. Next. So very, very important is all of us know that women in the reproductive age group and women during pregnancy, after delivery, and then the child which is growing. So all of these age groups require more iron than the normal adult. Next. So iron deficiency even alters the production of T3, T4. So again, he was talking about iodine. Iodine is also one of the important components for the production of T3, T4, which is readily available in milk. In the production metabolism of catecholamines and other neurotransmitters, and definitely that deficiency leads to all this, temperature insensitivity and all. Next. So whenever there is iron deficiency, body tries to absorb iron. So in this process, during absorption of iron, simultaneously there is increased absorption of certain toxic metals too. So iron deficiency can lead to toxic metal absorptions like poisoning of lead and cadmium too. Next. So a lot of factors, I'll take it up later. Demographic factors, dietary factors, and then social and physical factors that lead to or increase the risk of iron deficiency. Okay, next. So iron requirement, I tell you, per day is just 1 to 2 milligrams. We say the body is always in a positive iron balance. And the food we consume, food we have, has about 10 to 20 milligrams of iron, out of which an adult requires only 1 to 2 milligrams. So children and pregnant will definitely require more. But how is this iron available? What are the sources of iron? Which are the foods that give us iron? Which are the foods that provide us iron? Green leafy vegetables, yes, green leafy vegetables. How many of us eat green leafy vegetables? What is the frequency? Daily? Daily? How much? Monthly once. He says monthly once. Isn't it enough? Is it sufficient? So we divide the sources as heme iron, non-heme iron. So heme iron is all this, animal products. So where it is stored in the liver and spleen and all that. So whereas non-heme iron, we have all this. So what is, I think milk has very little iron in it. Milk has, that too mother's milk, So we say has very little iron. So nuts, eggs, resins, dried and baked beans, whole grains. Good source of iron. So dark green leafy vegetables. I know why they put chocolate. It's a processed one which is with added iron, but I won't advocate that. So if we consume iron, it should be in a natural form. not that you take. So they're all, to replenish our sources that are added next. So leafy vegetables, so the foods are now iron enriched. Next. So meat, so all the non-vegetarian food, and then there's poultry food, so chicken and all that, then fish. All these are quite rich in iron. How many of you consume this daily or once in a week? Only one? But I'm not promoting here. So being a strict vegetarian, I definitely do not promote eating non-vegetarian food for whatever nutrients or proteins or carbohydrates you have, because all of us know that elephant is the strongest animal. So elephant is a vegetarian. So we can equally be strong and healthy like an elephant with vegetarian food. So next. So this is again the thing. This is about the iron. So we consume about 1 to 2 milligrams of iron. So how is it utilized? So it is absorbed in the duodenum, utilized in the bone marrow for production of erythrocytes. So it's in the hemoglobin. We have the main source. It's a main source, main area where iron is utilized. And as all of you know, RBCs have just a lifespan of 120 days. At the end of 120 days, they're all destroyed. But once they're destroyed, whatever iron is there in the RBCs, that goes to the storage pool. It is not a waste at all. That's why we say one important cause for iron deficiency, apart from nutritional deficiency, is blood loss, bleeding, chronic blood loss. So one important again cause for chronic blood loss in reproductive age group in women is menstrual disturbances. So heavy bleeding, or whenever there's a tumor in the uterus or uterine lining undergoes hyperplasia, or in an elderly whenever there is a malignancy or cancer of the cervix or endometrium. So these people bleed a lot. So blood loss. So never neglect an excessive blood loss. Normally, as all of you know, menstrual blood does not clot. There's a fibrinolytic mechanism. Anytime the menstrual blood clots, there's a history of passing clots, be aware. You know that there's a lot of blood that is being lost, and there should be a pathology, or there should be a disease in the uterus that is giving rise to excessive blood loss. So don't just say, let me observe for a day, let me observe for 2 days, let me wait for 5 days, let me wait for 8 days. So in a normal cycle, a woman loses about 40 to 50 ml of blood. So if it exceeds, so there's a blood loss of about up to 1 liter or up to 500 ml, and 1 unit of blood what we take from you has 200 milligrams of iron. See how quickly you lose the iron from the body. So never neglect or postpone such things. So find out the cause. So go to your nearest consultant to find out what is the cause and not allow the body to lose iron also. Next. So 60 to 70% is in the hemoglobin. That's about 1.5 to 3 gram. And when we say totally our body has about 5 grams of iron. Next. Next. So these are all, I think as biochemistry students, all of you know about the iron metabolism. Let me not deal with iron metabolism. Straight away I want to come and tell you how you identify that there is iron deficiency and how to prevent this iron deficiency. And again, just recollect what are the good sources of iron. Next. Next. We'll skip all this. Next. So iron is absorbed in the ferrous form. This is very important. And we say whenever iron supplement is given also, we tell the patients not to take it with tea or coffee, which again interfere with phytates, interfere with the absorption. Next. So vitamin C is better, so it keeps iron in a reduced form. Next. 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 Excretion. So I told you body is always in a positive balance, state of positive ion balance. So amount consumed, amount excreted. So amount consumed is slightly more than the amount that is excreted. So how is it excreted? So all the cells do have little iron. So these formation of the epithelial cells, where we see regularly from the skin and from the gastrointestinal, the RBCs which are being lost, and unabsorbed iron, some amount is definitely excreted through the feces. Next. 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 Okay. See, iron deficiency. When do we develop iron deficiency? So the body stores I have shown you, say about 4 grams or 5 grams. Daily requirement is hardly 1 to 2 milligrams. It is more during the growth phase, reproductive age group, pregnancy, lactation. So how long does it require for a person to develop deficiency? So at first what happens is, the body stores are being utilized. So if you stop consuming iron today, so if your diet has no iron or enough iron, the body stores are being utilized for hemoglobinization. So first stage is iron depletion. So we do not see a person coming to us with a deficiency state initially, because there is body store that is being utilized. So once the body stores are exhausted, then we start manifesting with iron deficiency. So you need to look at yourself and find out whether you have adequate iron. That's why I say, ladies at all the age groups, we definitely love mirror, right? We love to be in front of the mirror, your age group. No, you spend a lot of time in front of the mirror, don't you? Yes. Yes? Teenagers, I tell you, spend a lot of time. Boys are no exception. So they are spending more time than us nowadays. So we spend a lot of time in front of the mirror. What for? To look at our beauty. Right? Yes? What else? When you look at your dress or whatever, it's again indirectly. So everybody wants to be pretty or good looking, so impress others. That's your age group. It's natural, it has to be. No, if nobody has that tendency, then it's something different, something abnormal. No, that's a normal process that undergoes in every teenage girl. Yes. So what I say is, whenever you stand in front of the mirror from tomorrow, start observing yourself. So apart from how is your hair and all that, your dress and all that, so please give equal importance for your body too. So how do you observe? So I'm concentrating only on anemia. So otherwise, for different ladies age group, I talk about the body shape, everything. So whether you are like an apple or a pear, it definitely counts a lot. So I missed his lecture. Otherwise, I would have said, the body shape and so how which fat is important and all that. Okay. So just look at your eyes. How a doctor looks into the at the conjunctiva. So just lower your eyelid and look at the color. What color do you expect? Red, pink. So red again, if we say we remember the Madras eye, no, the conjunctivitis, we don't want that red color. So it should be pink. So if it is pale, not pink, first indication that you have anemia, one indication. So next is, look at your tongue. All of you have seen your tongue. How is it? Pink? Yes, agreed there. Second point, it's only the physical appearance of the tongue, not the nature of the tongue. How is it? Not observed? Okay. Is it smooth or rough? Smooth? How many of you have smooth tongue? How many of you have a rough tongue? Now a question rises, which is normal, which is abnormal? How many of you have smooth tongue? Smooth tongue. He says tomorrow you're going to tell us. Okay? So I tell you, tongue has taste buds. the papillae. So, for the development of, even epithelialization, iron is required. So, normal tongue is pink and rough. Rough because of the papillae that are there. So, the moment you see your tongue as pale, not pink, bald. Bald. No papillae, it's smooth. Then that is another indication which says that you are suffering from iron deficiency. So start taking iron-rich food. Or even at this stage, it's a deficiency, so you need to take therapeutic iron too. Okay? So then, coming to the hands. So you're all fond of, keeping your nails beautiful. So color it according to the dress you wear, whether it's blue, green or red or pink, whatever it is. So just have a look at the nails. And how you need to look at the nails is just have a profile. See from the side. How is it? Flat, like this flow? Yes? No? How many of you have flat nails? Flat? No? It's not flat? Is it pink? Pink and not pale? Very good. If it is pink, good. Not pale. So it should have slightly a convex appearance. I'm very happy if all of you say you've got a convex nail. Okay? So flat nail indicates you are developing deficiency, and if your nail has become spoon shaped, so depressed, that's a frank anemia, frank iron deficiency anemia. So don't go to that level. Once it is flat, start taking iron. Second is, just look at the skin on the joints, small joints. Look at the color here. Compare it with the skin which is adjacent. Is there any color difference? Yes? Yes? Good. What is the difference? It is slightly dark where? The joints. How many of you have darker color of the skin and the joints? So again, I quote Professor Manjunath, from tomorrow you're supposed to take 2 glasses of milk. 2, not just 1 glass of milk, you have to take 2 glasses, because that is one thing which is indicating that you have folic acid deficiency or vitamin B12 deficiency. Very early manifestation, that hyperpigmentation, or this is knuckles, this knuckle pigmentation indicates that you've got B12 and folic acid deficiency. Very easy source. Instead of taking, whatever medicines that are available, start consuming 2 glasses of milk from tomorrow. Just see how it disappears. So these are small things you can observe yourself and say whether you have adequate hemoglobin or not. So don't allow that to proceed further. So B12 deficiency is, the early manifestation is this. Next. So causes, I told you all these causes. Chronic blood loss, I told you only menstrual blood loss, but there are other causes like any disorder in the gastrointestinal tract, including hemorrhoids. None of the patients go to the surgeon when they have hemorrhoids. It is bleeding through the rectum. They consult all sorts of other people and then land up with the surgeon. By that time, they would have lost a lot of blood. And another thing is hookworm infestation, which is very, very common in India. Next. So each hookworm consumes about 0.2 ml of blood. So these hookworms, like a hook, it hooks to the intestinal mucosa. And it's not just 1 or 2 that are present in the intestine. You can see hundreds of them in the intestine. So whatever blood you have, so they're sitting. So you're donating blood to these hookworms which are very happily thriving in your intestines. And how we recognize this iron deficiency in the laboratory is by a simple test, that is a peripheral smear that is done. So the RBCs, what we see in iron deficiency, are smaller in size and they do show very less hemoglobinization. The central area in the RBCs appears pale compared to the normal RBCs. And apart from this, we have biochemical investigations where we estimate the total iron content, that is serum iron, then the iron binding protein, and then the iron transferrin or the iron carrying protein. So all these levels will definitely prove whatever we have seen now in the patient, and whatever is substantiated by the peripheral smear. So we have 100% confirmation by biochemical investigation. Next. So whenever there is iron deficiency, so you look pale, you're not at all active. The moment we ask you to walk for a certain distance, you feel dyspneic, you feel that fatigue or weakness, and then pica is something. So many people, they have this habitual ingestion of unusual substances like clay. You may see, people eating this brick pieces, mud and all that. So whether that gives rise to iron deficiency or iron deficiency without is not very well known, then irritability, rapid heart rate. Iron deficient, not just iron deficient, anybody with anemia, so you feel your own heartbeat. So now our heart is beating. Unless we are scared, we are tensed, we are anxious, or we have worked or exercised, we do not find that the heart is there. It keeps on functioning, it keeps on beating, it does its function on its own, without even making us know that it is working all the time. So only when we are scared and under all the situations, we can feel the heart beat. That is palpitation, especially when you are scared. So people who have anemia have this increased or rapid beat. So shortness of breath, you cannot walk, cannot speak, so this is exertional dyspnea, you become dyspneic, so difficulty in breathing, and decreased appetite too. Next. These are all the laboratory tests that are done to confirm iron deficiency. Next. Treatment again is about the causative disorder. So what has caused iron deficiency? One is it nutritional deficiency? Then even if the person is adequately taking iron, so why is it not absorbed? Has he got a malabsorption syndrome? Or in spite of adequate consumption of iron, is he having a hookworm infestation? Or what is the cause for this iron deficiency? Is he having any disturbances or any sort of bleeding? So first we need to know the cause, treat the cause and not just supplement the person with iron. Next. So I just go to prevention. Very interesting. So that's where your hygiene counts. Next, yes. Previous. So I told you all these are examination. What you are looking at your tongue, the nails, and of course the conjunctival photo I have not put. Look at the two nails, how they are. They're typically spoon-shaped. So we do see patients coming with this spoon-shaped nails. We call it as coilonicate. If you just put a drop of water, it can hold that water very well. It's so much depressed. Next. This is a typical blood picture of iron deficiency, how the RBCs appear. Even RBCs are pale. We see only the cell membrane. Next. The previous. This is one special stain what we do to demonstrate iron. This is a bone marrow picture. You know the blood, the hemopoiesis occurs in the bone marrow. So in the bone marrow, this iron is present the precursors of RBCs. They are the nucleated RBCs which are there, the erythroblasts. This is a special stain called as Pearl stain or Prussian blue stain. So iron takes a blue color. What we use is, in an acidic medium, we use potassium ferrocyanide. So it's converted into ferric ferrocyanide, which is a blue colored compound. Next. Yeah, prevention is very, very important. That's why I've taken this topic for you. So you need to know prevention. First is to prevent the deficiency within yourself. Then your learning becomes very easy. So once you have adequate iron, so you have adequate hemoglobinization, so you become more energetic, so you are active, your body functions very well, and your learning also is definitely improved. So first 5 to 6 months of life, the body stores are adequate. Then the breast milk or an iron fortified infant formula, if the child is only on breast milk for 6 months, we say, later on the child requires an iron fortified formula. Then iron supplement, I told you, as after 6 months, it's very, very essential. And if the child is born prematurely, if it's not a full-term delivery, then this child requires a lot of iron. Supplementation has to be given next. So eat or encourage iron-rich foods. So we have quoted so many foods which are rich in iron. But how many of us really eat all this? We just keep whatever is nutritious aside and we eat whatever is tasty. So that adds to our calories but does not supply enough minerals and vitamins that is very, very essential. Adolescent girls and women who have anemia usually prescribe an oral dose of 60 to 120 milligrams per day. This is because I told you, so if adolescent girls are not treated for iron deficiency anemia, then the progeny, what we expect from them. So all these neonates who are born to such women in the reproductive age group are of low birth weight or they land up with premature delivery. Next. So treating hookworm infestation is very, very important. So one is nutrition, yes, so supply iron. So treat hookworm infestation. How are we getting infected with hookworm? How are we getting, anybody who knows about hookworm infestation? Very important to prevent because, still we have open field defecation. No proper sanitary facilities that are available. So people defecate in open lands, fields. So imagine one person who has got hookworm infestation. So he defecates in the open field. So along with the fecal matter, lot of eggs, hookworm eggs are excreted. So that remains in the soil. So if you know the development cycle of this, so these eggs develop into larvae. So they are there in the mud or the soil there. And how do these farmers work in the field? How do they walk? They all walk barefoot. So we work with all this bare hand. Nobody wears a glove. So these larvae make entry into the body through the skin. So which route do they prefer? So they go through the skin of the feet and the hands. Is it so easy for the larvae to penetrate the sole? Sole is so thick. It's got a thick keratin layer. It's difficult. Even palm has got keratin. But it's very intelligent. It finds a way between the toes. The skin between the toes is soft. So it enters through that. So between the fingers or between the toes. So we'll never know that it has entered into our body. Some people have, visceral larva migrants. So once it goes, moves in, there may be some dermatitis or reactions in the skin. Otherwise, many of us will never know that this parasite has made an entry into our body. So what has to be done now? How do we prevent this? Agriculture is our main work or job. So 60% of the people depend on agriculture. Then how do we prevent this hookworm infestation? So now a lot of money is sanctioned for most of our NGO groups to build toilets, provide proper sanitation.